Today, we're going to pull back the curtain on one of the most personal and sometimes intimidating conversations you can have with a doctor, the gynecological history. We're going to break down what it is, why all those questions are so important, and really, how you can be a true partner in the process. Let's dive in.
I mean, we've all been there, right? You go in for one thing, and suddenly the conversation feels like it's covering every corner of your life, from your family to your daily habits. It can feel a little intense. But, as we're about to see, there's a really good reason behind every single one of those questions.
So here's how we're going to break it all down today. We'll start with the why this history even matters. Then we'll get into how your story gets told. After that, we'll decode some common symptoms, see how all the pieces connect, and then we'll wrap up with the most important part, your voice in the room. Okay, first things first. Let's be really clear about what this conversation is and what it isn't. This is not an interrogation. It's not a test you have to pass. It's a collaborative effort, a structured conversation to build a complete and accurate picture of your health.
You know, when you look at the official definition, two words just jump right out: systematic and sensitive. Systematic means there's a method to the madness, right? It's organized, not just random questions. And sensitive is just as crucial. It means the whole point is to handle this information with care and respect, all to figure out what's best for you. So, how does this whole thing kick off? Well, it all starts with you. The entire conversation is built around your story, in your words. The fancy medical term for this is the history of presenting complaint, but really, you can just think of it as the part where you explain what brought you in today.
A good doctor isn't going to start by firing off a bunch of yes or no questions. Nope. They'll start with something open, like, so, tell me what's been going on. And that's so important because it gives you the space to describe not just the symptom, but how it's actually affecting your life, your work, your relationships, your sleep. That context is everything. Now, here's a little insider tip. When a symptom involves pain, a lot of doctors use a kind of mental roadmap to get the full story. And it goes by the acronym SOCRATES. It's such a brilliant way to break down the pain, from where it is, the site, and when it started, the onset, all the way down to what makes it better or worse and its severity. It's a tool for them, for sure, but it's also a great way for you to organize your own thoughts before an appointment.
All right, so once the main story is on the table, the conversation usually shifts to digging into specific symptoms. You can think of these as clues, little pieces of the puzzle that, when you put them together, start to form a much clearer picture.
Let's take abnormal bleeding. It's a really common concern, but as you can see, when it happens, tells a completely different story. Bleeding between periods points to one set of possibilities, while bleeding after intercourse could be something totally different, like a harmless condition on the cervix called an ectropion. And then, bleeding after menopause always needs a close look to rule out issues like thinning tissue or atrophy and other more serious things. Each one is a totally unique clue. And then there's vaginal discharge. You know, it's a completely normal part of life, but the key word that doctors are listening for is change. Any big shift in the color, consistency, amount, or smell, that can be a really clear signpost pointing toward a possible infection. And this table perfectly shows how your menstrual cycle gets decoded. It's so much more than just asking for the date of your last period. It's about the whole pattern, how often it comes, how long it lasts, and how heavy it is. Now, these clinical averages give us a baseline, but honestly, what's most important is knowing what your normal is, so we can spot any big changes.
Okay, so we've got the main complaint and we've drilled down into the symptoms. Now it's time to zoom out and start connecting those dots with the rest of your health history. This is where that bigger picture really starts to come into focus.
Your past medical history is basically the foundation of this whole story. Things like previous pregnancies, what your last smear test showed, or any surgeries you've had. They create this health timeline that gives so much essential context to what's going on right now.
And of course, we have to talk about any medications you're taking. This is another huge piece of the puzzle. What kind of contraception you're on, whether you're taking hormone replacement therapy or HRT, or even if you just finished a course of antibiotics. All of these can have a direct impact on your symptoms. Next, you'll probably get questions about your family's health. And this is because some conditions, like certain cancers linked to the BRCA genes, can run in families. Knowing if there's a pattern in your family helps your doctor get a better handle on your own personal risk factors. Now, this part of the conversation, the bit about lifestyle, I want to be really clear here. This is not about judgment. It is about understanding every single thing that could possibly be influencing your health. Things like stress from your job, your diet, smoking, they can all have a real, measurable effect on your gynecological health. And that leads us to the final, and I would argue, the most important section of all, your voice. This whole thing is a partnership, and your perspective, your feelings, they are a critical piece of this entire puzzle. So near the end of the conversation, the doctor should sum up everything they've heard, and this is your moment. It's a sanity check to make sure they've got it right, and it's your chance to say, hey, wait, there's one more thing, or to clear up something you think is really important. And here is a super simple but incredibly powerful tool you can use to make sure your voice is heard. It's the acronym ICE. Before you leave, try to make sure you've shared your ideas about what you think is going on, your concerns or biggest worries, and your expectations for the visit. Saying these things out loud helps make sure that whatever plan you come up with is actually aligned with what matters to you. So, as you can see, the gynecological history isn't just a boring list of questions. It's a collaborative process, like writing the first draft of your health story together. And the big question we want to leave you with is this. Now that you know the why behind it all, how will you help shape that story? Because remember, you are the lead author.